Good morning, everyone. Myself, Dr. Kirti, Assistant Professor, BPT. So today we'll discuss about the sensory motor system. The sensory organs in the neuromuscular system are referred to as the mechanoreceptors, sensitive to various forms of mechanical deformation, including tension, compression, and loading rate. These small sensors are located in various connective tissues throughout the body. The three classification of mechanoreceptors are based on the tissue location: joint receptors, cutaneous, that is skin receptors, or muscle receptors. So first we'll discuss about the joint receptors. Roughened receptors endings are described as slowly adapting mechanoreceptors because they continue their discharge in response to continuous stimulus. Receptors have low activation threshold and are active during both static and dynamic joint conditions, and these send or signal the static joint position, intra-articular pressure, and amplitude and velocity of joint rotations. Golgi tendon organ-like receptors are the largest of the articular mechanoreceptors. They are also slow to adapt to stimulus, have a high activation threshold, active only during the dynamic joint states. And some also suggested that high threshold of the Golgi tendon organ-like ending make this receptor ideally suited for sensing the extremes of the joint normal movement range. Pectinean corpuscles are the only rapidly adapting joint receptors sensitive to low levels of mechanical stress. The Pectinean corpuscle is active only during the dynamic joint state, therefore, this receptor is silent during the static conditions and constant velocity situations, but is sensitive to joint acceleration and deceleration. Prenerve endings constitute the fourth type of joint receptor, widely distributed throughout most joint structures. These receptors are typically inactive during the normal activities, but when activated by high levels of noxious stimuli, they are slow to adapt during both static and dynamic states. Thank you.